Hello and welcome to Immune Matters, the podcast, the official podcast of the PIDTC, where we go into all sorts of immune-related things, both from the clinician and from the patient perspective. I'm Dr. Jack McDonnell. I'm a pediatric immunologist at the wonderful Cleveland Clinic. You can see the gray sky out there. That indicates we're in Cleveland. I will be joined in a minute by Dr. Elie Haddad, who is an immunologist, a bone marrow transplant physician, and a scientist at CSU Saint-Justine in Canada. There you go, Elie. And so we are delighted today to welcome Dr. Simon Tabchi to the podcast. He is a survivor of Wiskott-Aldrich and bone marrow transplant, and he brings a very unique perspective for us. So I hope you enjoy the podcast. Now, a reminder, I always have to say that the views of this podcast, the views of Elie, myself, and our guests does not necessarily reflect the views of the PIDTC or our institutions. So hope you enjoy the podcast. Right now, it's our pleasure, Elie and I, to welcome Dr. Simon Tabchi to the program today. He is a survivor of Wiskott-Aldrich and the transplant process. Simon, welcome to the program, and tell us a little bit about yourself.
Thanks, Jack. So my name is Simon. I am a Wiskott-Aldrich survivor. I was diagnosed at a young age. I had a bone marrow transplant in 1997, so I'm almost 29 years status post bone marrow transplant. So I've been very fortunate. The path for myself as well as for many both Wiskott and immunodeficiency patients is usually a rough path in the beginning, but those who are fortunate enough to survive the treatment and get through it usually end up doing pretty well. And thankfully, knock on wood, I've been able to do pretty well, especially from a health basis, status both bone marrow. When I was younger, I was treated at Children's Hospital Philadelphia. About the age of 3, they took out my spleen. My platelets were low, so they thought it was my spleen really attacking the platelet count. And then it was around the time when Dr. Sullivan, who specializes in this type of stuff, when she joined with my immunology team at Children's Hospital, is when she herself, as well as I remember Dr. Green, they both came together and really made the diagnosis. I can't remember exactly what age I was, but it was somewhere between the age of 3 and 6 of when they made the official diagnosis. So my diagnosis was made a little bit later. I mean, that was really in the early 90s. So we've had a lot of advancement in the field since then. My parents were immigrants from Syria, and it was the first time they were really dealing with this. And, there was really a communication barrier as well between us. So, all you're hearing is your son has this diagnosis. This is really the only treatment for it. How do you want to address it? And, to that, it's a scary thought, even for those who understand the medical field. It's a scary thought. It's scary to think of. All you're thinking about is the well-being of your child and the survival and everything like that. It took a couple years, but my parents finally decided to go through with it. I could still see Dr. Green really pleading literally going down on his knees and begging my parents, please do the bone marrow transplant. It's really his only chance. So I was about 9, turning 10 when I had my bone marrow transplant. I was very fortunate. Both my sisters were perfect matches. One of my sisters was completely healthy. The other one, allergies and this and that, but nothing crazy. But they wanted to go with the healthier sibling, and everything went according to plan. I was much older, so I was able to understand a little bit more of it. I think the weird part about it, I shouldn't say weird, but the difficult part about it is, at that time, it was especially for my parents, a diagnosis they've never heard of. They didn't understand. It's X-linked, so it's usually, it's passed down from the mother. As we got older, my oldest sister, who was my donor, is also in the medical field, and we talked, and we really think the mutation happened with my mother, because my mom has uh, 7 sisters, and not one of my cousins has ever had it. So we really do truly believe that it was a mutation that happened and started with my mother. But thankfully I was fortunate enough to, go through the process. And since then have been leading, pretty normal, healthy life. Unfortunately, both my sisters had sons who also had it, who also had to go through the bone marrow transplant. And are
Okay,
thankfully healthy and doing well at this point as well.
okay,
So,
so just to explain a bit, since it is
yes.
X-linked, the sons can be sick. It will be
Yep.
50% of the son,
Yep.
but and the daughters, it will be also 50% of the daughters will be carriers.
Yep.
And it appears that both your sisters
Yeah.
are carriers.
Yeah, we're the lucky ones.
Exactly. And because they are carriers, both of them, if I understand well what you just said, gave birth to a nephew, both nephew of you who have the same disease.
Who both had it, yep.
And how have they been treated?
They have been, but the oldest of the nephews was, I wanna say about 10, 11 months old when he was treated. And then my other nephew, he was about 2 years, maybe about 2 years old by the time he was treated. My, with my older of the nephews, when he was treated, it was actually my mom who picked up on it. She kinda saw the same signs that she saw when I was younger, and she's really the one who urged my sister to have my nephew tested to see what the heck is going on.
Mhm.
And thankfully she did, and they were able to catch it at a very, young age. But, it was kinda one of those where, uh once I got through it and went through the treatment and recovered and everything, you kind of want to uh, take it out of your memory, so to say. So we kind of always knew that my sisters could be carriers, but I think it was one of those where we didn't want to admit that it could be possible, just because we didn't want to deal with it again until we had to. Um, but yeah, but thankfully, both nephews are doing well and healthy and in school and pretty much back to normal. So
So what you said is interesting because you said you wanted to put that away from your life,
yeah,
and then the family history brings you
I had
back
to
there.
go
So it
back all
means
through it.
that it so it means that speaking about it, thinking about it is suffering from you for you?
100%. Yeah, and like I said, I was about so 97. It was the summer of 97. I was 9 years old. I think it was tough on me just because I was older. I was already in school. I had friends. So to be completely ripped out of my environment and not being able to be around anybody for almost 6 to 9 months, that was, I think, the hardest part. The treatment and all that. There's still some meds where I say their name and I'm thinking about it now and I just cringe, just because of the taste of it. And especially cyclosporin was, I think, one of the
Yeah,
worst
it's awful. Yeah.
and disgusting
It
ones.
tastes like oil.
Yeah, yep. So, like hearing words like that really drive me bonkers. I remember every single second of the experience, which is again because I was older. But the worst thing was the socialization aspect, not being able to play with my friends, see my friends, go to school, do anything normal for several months, even up to a year, was for me the toughest. Because once I got through the actual bone marrow and the treatment, it's one of those where mentally you just, even at that age, you just kind of dealt with it. But the socialization aspect is really what was the toughest.
It's interesting because at this time, I remember I was also a transplanter at this time in the 90s. We used to keep the patients very long. We were very frightening of the infections, and the conditioning regimen were maybe a bit more aggressive. So we were fearing infections, and it was classical
to keep the patients long time. Now it has changed, and we try to send back the patients
Yeah.
home as soon as possible, and
Mhm.
we open the possibility of having socialization way before what we advised
Yeah.
in the 90s. So yes, you have experienced bone marrow transplantation in the 90s.
Yeah.
Absolutely. And we learn
That,
from you. You know, that's important
yeah.
that we get this feedback. So tell us a bit. Now you are involved in patient advocacy groups.
Yes, I am on the board for the Wiskott-Aldrich Foundation. I
And
do a lot of work.
tell us why and what it brings to you. Because on one hand, excuse me, I extend my question. On one
Mhm.
hand, you say I don't like going back there, so it means that you suffer from that. But on the other hand, you involve yourself in the pack, so by definition, you're going to go back there. So
Yeah.
explain us a bit this
It's
control, this paradox.
so really, I mentioned my oldest nephew again. He'll be 8 this year. So this was about 7 years ago. Um, I wanted to at that point I was, talking to my sister and my brother-in-law and kind of about, getting this done sooner and telling them about my experiences and stuff like that. And then, it kind of triggered in my head, well, why am I not offering those type of services to other families? To other survivors, to other, people who are going through the same thing that I had to go through, knock on wood. When I went through my treatment, everything went very smoothly, which I was very fortunate. And I know it doesn't happen with everybody. But, why not, make myself available to families who are, just starting the process and kind of give them that hope, that, during the process, you're going to go through an emotional roller coaster, but they will be okay. Once they get through it, they will be okay. So that's about the time when I reached out to the actual Wiskott-Aldrich Foundation, and Sumathi reached back out and we spoke and, requested that I, join the board. I'm the only one on the board who's an actual bone marrow transplant survivor, I believe.
Mhm,
Don't mark my word, but I'm almost certain. Um,
mhm.
and, through the foundation, I've been able to speak with numerous families that Samathi has directed my way in order to, just give them hope, give them advice, let them know kind of what the next steps are going to be, what to look for. Excuse me. Um, and what the future looks like, even with, sorry, even with different survivors that I've spoken to as well. For my wife and I, we unfortunately had a little bit of difficult time conceiving in the beginning. But I had some treatments, and knock on wood, thank God we have 3 perfectly healthy kids, all biologically mine. So even from that standpoint, and talking to gentlemen who are in their early 20s or first getting married and want to start their family, and talking them through that process as well. It's not only trying to help those who are currently going through it, but also the aftermath. What should they expect? Who to go see even, what specialist to go see, who to discuss with, if they are having trouble with this or that. I just felt that it would be very selfish of me not to provide those type of, um, I don't want to say services, but just to be an advocate and
Advisor.
be there
Yeah,
for people
yeah.
who need it.
You would have
Uh,
loved you would have loved to have this kind of person to talk to, I
Yeah,
suppose.
absolutely, 100%. I wish my parents had something like this when I was going through it, to at least, talk to them. And if I'm able to, why shouldn't I be?
So you're giving back to others what you were
Absolutely. Yeah,
missing,
I think
what you
it's,
were
I
missing at.
think with everything we do, I think it's, we're all in the medical field. That's kind of in our blood to help others and
Yeah.
give back and everything. So, it's
And
kind of,
and
it doesn't just stop in the office. It's kind of with everything.
and does it bring to you fulfillment,
I do.
joy,
I love
happiness?
it. I do. I do. I love it. I just, it's, it just, just giving him that hope, just that, y- the medical technology nowadays is so advanced with so many things, and being able to really just to provide that support and even just give them a direction of which way they need to go, I think really helps. Right now we're in the middle of trying to start a Facebook page associated with our foundation for male survivors who are older, who have those type of questions, in order to, have a kind of private forum for us to hopefully, answer questions and discuss things and, feed off of each other. So that, that way, you're not alone. There is others who have gone through it, who are going through it, who are there for you and who really care about the well-being of each other.
Yeah, that's very interesting. Thank you. I have a specific question. Now in the field, there is a new therapy, gene therapy. That is
Yes, I saw, I read
almost
that.
available. Let's say it's not available, but it is there.
Hmm.
Um, how you did not have access to that,
I
obviously.
did not.
Uh, how do you see that? How do you discuss about that? This aspect that you went through something that is called bone marrow transplantation, and now there is another option. What does it make to you?
I'm glad there's another option. Because not everybody um, is able to find that donor. For those who are unsuccessful with finding an actual match in order to go through that, you know, if this was in the 90s, you're unfortunately out of luck. But now that there is this gene therapy and something there that is gonna help, it's just another weapon in the toolbox to use in order to fight this disease and beat it, and allowing the patient to live a healthy lifestyle. So I love
So
that when I saw that, and I think Sumathi first sent it out to us. I
yeah,
thought that was such a great thing.
oh,
So
great news. So
yeah,
your role is to explain what is a bone marrow transplantation because you don't know what is gene therapy, so you can help patients and families to decide when
yep.
the choice is given to them.
Yeah, absolutely. So, the fact that it's available again it's fantastic. And I hope that they continue to do research, and find even other therapy and meds that will, make it easier.
Mhm.
Bone marrow, it's tough. It's a tough process. And it doesn't unfortunately always take. Um, so to have that other avenue and other treatment option for patients and people going through it it's definitely a plus. Something like that is never a negative in my book. So
Maybe a difficult one. You described as many good sides as being in a PAG. Is there any dark side
to
being
what?
in a
Being
PAG,
in the
being
bag.
being in a patient advocacy group? Is there bad things to be there?
Um, Honestly, I think it just comes down to the person, really. I like I said, I kind of cut it away from my head for so long. Just, it was something at that point where, uh, I went through it, left it in the past, and kind of wanted to keep it in the past. But, as I got older and started having, more immediate family members who are affected by it kind of opened your eyes. Obviously when we're younger, we kind of just think, I don't want to say selfishly about ourselves, but we kind of, are trying to do our own thing, worry about ourselves, get through the schooling, get through med school, get through residency, all this stuff. But uh, as I got older, it's something that I'm glad I'm now a part of. We have such a great board on the foundation. We do a lot, especially with advocacy and raising funds and helping patients worldwide with Wiskott, trying to get treatment, helping pay for either treatment or for the family to stay somewhere for while their child gets the treatment. It's a beautiful thing to see, and I love that I'm able to be a part of that.
And I was reading a little bit, Simon, that Now, I have been known to Google my guests before the thing,
fine.
and something popped up there that, and I hope you don't mind sharing this with us,
That's
that
okay.
you had a difficulty getting life insurance, right? Because you had
Yes.
Wiskott-Aldrich that was
Yeah.
cured by bone marrow
Yeah.
transplant, but no
Yeah.
one wanted to insure you. And I think that's
Mm.
something that many people would not even imagine that that would be a possibility for their patients
Yeah.
down the road. Can you tell us a little bit about these unexpected, potentially experiences that you have after a transplant?
Absolutely. So, again, when you're younger, you don't think about any of that stuff. But once I, started having kids and thinking, well, what the heck is going to happen to them if I, God forbid, pass? That's life insurance is something that we turn to. I was shot down by, oh God, probably 10 different companies before I finally came across. It's through Transamerica. They were able to see past that. They saw all my medical records literally from the past 20 some years and saw I was perfectly healthy. Wiskott, it's almost like you're tainted once you have Wiskott and a bone marrow transplant, and it's like a dark stain on your record that, oh my gosh, they see it and no one knows how to act about it.
Right.
Not many people understand it unless you're actually in the field or have gone through it or anything like that. But thankfully, I was able to speak with an agent and his bosses, and they were able to see past everything. They did the typical workup for the life insurance, and I was able to get a policy for a normal, healthy individual at my age. I think I was about
Okay.
29 when I got it. And fortunately, it was about a year, maybe 2 years. I was able to sit back down with Transamerica and one of the higher ups, and they actually gave us the contact information of a person for other survivors to contact that we've made public to other survivors of who they should contact in order to get life insurance, because it was tough. That was a tough process. I mean, I kept getting denied just by about everybody, even though I was perfectly healthy. Lab work was completely healthy. It was just they saw that and they saw bone marrow transplant, and everybody just freaks out. But even again, back to the advocacy, even something that simple that we're able to do typically in life as a healthy individual, had a lot of problems going through, but thankfully it all worked out, and thankfully there was, a company that was willing to help
Yeah,
myself
and it's
and make themselves available to others as well. So
so it's particularly interesting because Wiskott-Aldrich, the gene of the Wiskott-Aldrich, is expressed only in the blood cells. It's not expressed anywhere else. So
yep,
when you do a bone marrow transplantation, if there is a full engraftment, then logically, scientifically, biologically, you are cured. We have
exactly.
removed the problem.
Yep,
So it's interesting that despite this aspect, the insurance don't think this way. They think in terms of boxes, in terms of risk, in terms of
yep,
probability. It's not very human actually, and it must be sad to be seen to see yourself as someone who is cured, but in the eyes of the others, of at least of the insurance, they don't
yeah,
perceive you as cured.
absolutely.
It's difficult. I
It
understand that.
is. No,
Yeah,
100%.
yeah,
It's unfortunate that it's even that way, but it's part of the system, unfortunately, and we were able to finally get past it.
yeah. Congrats. Very inspiring.
Thank you.
So what are some of the things that you might tell someone going through this process for the first time? Maybe a new diagnosis of Wiskott-Aldrich, because Elie and I, especially me, I'm very removed from the actual transplant process. I just kind of make the diagnosis and I send him to the transplanters, and then Elie enters in and he's actually more involved in that process. But
A bit more. Yeah,
more. But I think all of us could learn a lot. Again, I'm learning stuff right now, hearing about from the patient's perspective that I never thought about, like the fact that it makes total sense, but the fact that the socialization part was the hardest, and the fact that cyclosporin to this day just fills you with a bad taste in your
It's
mouth. What are some of these other things, like what kind of take us through how you help a patient through this process as we're trying to help them with the medical part.
Yeah, so I mean, it really depends on the age of the patient. Most of the time, it's parents that I'm talking to, and the advice I always, those who are skeptical, skeptical of going through with bone marrow, I always urge them: the younger, the better. And that's because of the whole socialization aspect. Uh,
And
you know,
not only, it's a medical result also.
yeah,
The
I'm
earlier
sure.
you transplant, the better the outcome is. So even
I
if
100
you stay, if you stay,
100%. Yeah.
yeah,
So the earlier the better. Once you get that diagnosis, um, listen to the doc, especially, the transplanter. They know what they're talking about. Um, the sooner that you can get it done for the child, the better. Don't hold off. Um, you're gonna have good days, you're gonna have bad days. It's really gonna depend. The child is gonna have good days, the child is gonna have bad days. The day of my actual transplant, I remember, everybody has different experiences. I was not tired at all. I was, I still did my physical therapy for that day, walked around the halls. I felt like a new person. Others that I have spoken with on their who are older, who were transplanted, and on their transplant day, they were tired, laying around, sleep for most of the day. So everybody has different experiences. But there's always going to be good and bad days. Give yourself that 6 months to a year, whatever it is, of off and on, good day, bad day, good day, bad day, whatever it may be, but get through it. Because once you get through it and the child is, hopefully fully engrafted, it's all upwards from there. And getting back to a normal routine and normal lifestyle and normal functioning for the child. So, my advice is always get it done as soon as possible, in order to better help the child and the survival and everything like that.
yeah, that's very interesting, very inspiring. I love
Thank
this
you.
interview.
Yeah, and
I
I
know
could talk
this
You
is
know, you,
I could talk about this all day. I love
did you notice
um
that I lost my accent? No.
it fades in and out, Elie.
Yeah, it failed.
Well, and you're a very elegant spokesperson for this disease, and I mean, I was going to ask you about this too. I think part of it could be that you have a lot of medical training, and
I think
so
that helps a
do you
lot.
find that that's kind of an
Yes.
asset?
Yes,
Yeah,
it helps a lot in terms of knowing especially how much information to give a patient, being an advocate without being a uh how should I say this? Advocating and letting them know kind of what to do, how to do without telling them
dictating.
what to
Yeah,
do. If I don't know if that makes sense. But it helps because having that medical background allows you to I think answer the questions a little bit better. Some of the questions I do get are a little bit more medically based, so I could again answer them from an advocate aspect and be able to uh, tell them uh, things in layman's term without being too medical, but as well not being you know without being their actual physician. Um,
Yeah, that's important.
I think that's a big thing. My role for those in our community is again just to advocate, be here for whatever questions that they may have, and try to answer them to the best of my abilities without actually giving them medical advice. I guess would be the best way to go about it.
And
I yeah.
the opposite question, how being a transplanted patient and how being a patient advocacy, being in a patient advocacy group helps you to be a better doctor.
Honestly, going through the process is why I wanted to get into medicine to begin with. Um, you know, I, I my doctors were amazing throughout the entire process. My transplanter was Dr. Bunnan at Children's Hospital. She retired, I think, about 2, 3 years ago. But she still remembered who I was, even when my oldest nephew went to her. Just because I think I may have been her first Wiskott-Aldrich patient that she had to transplant. But having gone through it, it's easier for me to be more empathetic with my patients. It's a completely different field, obviously, but for patients who I have to operate on or do surgery on or anything like that, that empathy really stems from going through it, and seeing how my physicians treated myself as well as my parents. They treated us like family, and I try to kind of be the same with my patients as well. Just because of that experience. That whole experience is why I wanted to get into the medical field to begin with. And I'm glad I did. And, it allows me to really put myself in their shoes, because I have been in their shoes, even if it's for a completely different diagnosis. They're still going through something that's uncomfortable, that's painful, that they don't really want to be going through. And you're able to see it through their eyes that, you could tell them it's going to be okay, that they will get through it. I also have, I treat a lot of neuropathy as well. And a lot of neuropathy that I treat is, I see a lot of patients who are currently or have gone through chemotherapy. And having gone through chemotherapy, I'm able to also kind of relate to them, what they're going through and how sick some days they have, how good some days they have. So not only from foot and ankle aspect, but just talking to them about other illnesses and everything they're going through, and just even being able to talk them through that and give them hope, and that everything, once they get through it, they will be okay. So
Well, thanks for sharing
Great.
your stories.
absolutely.
Yes, thanks for sharing that. I love this interview.
This was
Thank
great.
you.
Yeah, thank you for sharing with us. I think we're right at our time. Again, you've been
Perfect.
a very eloquent spokesperson from the patient perspective about a very challenging disease. And Elie and I and everyone else, we're super glad we had a chance to talk to you and hear
Me
your
too.
experiences.
Thank you very much. I appreciate it.
Thank you.
Thank you. Have a good day.
Have a good day.
Thank you.
Take
You
care.
too.
Thank you to Dr. Simon Tabchi for joining us on the podcast today and sharing his experience and his stories related to what happened to him with Wiskott-Aldrich and bone marrow transplant, and all the great work that he has done since then, working with the Wiskott-Aldrich Foundation. So I'm grateful for our guests. I'm grateful for my co-host, and for really all of you for listening as we try to get into the immune system and discuss it further. If you enjoyed this episode, please be sure to subscribe, hit that button, it helps us out, and share it with anyone who might benefit. And as always, you can learn more about the PIDTC at our website, which is, and I do have to look down on my paper for this, https://pidtc.rareddiseasenetwork.org. Thanks for listening. See you next time. The Primary Immune Deficiency Treatment Consortium, PIDTC, is a part of the Rare Diseases Clinical Research Network of the Office of Rare Diseases Research, ORDR, National Center for Advancing Translational Sciences, NCATS, National Institutes of Health, NIH. This work was supported by the Division of Allergy, Immunology, and Transplantation, National Institute of Allergy and Infectious Diseases, DAIT, NIAID, and the ORDR under cooperative agreements U54AI082973 and U54-NS064808, and grants R13-AI094943 and 1R24AI184316-01. The content and opinions expressed are solely the responsibility of the authors and do not represent the official policy or position of the NIAID, ORDR, NCATS, NIH, HRSA, or any other agency of the U.S. government.